It is my pleasure to introduce Professor Morshuis. He's the leader and senior consultant of our LVAD and transplant team here in Bad Oeynhausen, and he will give his first talk on the history of LVAD implantation and the update on the strategies.
Yes, Vera, thank you very much for this nice introduction. Thank you for inviting me as a surgeon in your seminar. I'm happy to do that because we have to work together quite a lot, and I think it's combined effort, LVAD implantation. So I was asked to talk about the history of LVAD implantation and new insights. So I will start with the first part of my presentation, history of LVAD implantation. And in fact, the history is quite long. You know, Professor Kolff started to develop a total artificial heart already in '57. And you know, to be honest, when you see this heart and you compare it to the actual Syncardia system, it looks quite the same. So some things are still more or less on the market, developed in the '50s. And then a very famous name in the cardiac surgery, DeBakey. He did the first LVAD in '66, and it was even a bridge to recovery. So he could explant it 10 days later, but it was the first experience and quite successful. We, in our center in Bad Oeynhausen, we started our program in '89, and that was the Abiomed BVS 5000, an extra corporeal system, so that we couldn't mobilize the patient, but it was the first step, and it went quite well, in fact. Then we went to the Thoratec PVAD system in '92, which was, of course, much better, because we could mobilize the patients with these systems, and you could use them as LVAD or BiVAD systems. And with the new driver, we could, we could even send patients home with this system. And that was, I think, a very important step, you know, in '92, that we could start send patients home on LVAD or even BiVAD therapy. So the next step was '93 with the Novacor LVAD. It was huge, it was really bulky, but to be honest, it worked quite well. And also with this system, we could send the patients home. A big step further was '99 with the LionHeart. So the special thing of the LionHeart was it was completely implantable, so we didn't have a driveline. And as we all know, driveline is still the cause of many issues, so to say, driveline infection. And this was completely implantable. Here you see the pump, here you see battery and controller combined. This was for charging the battery. And this was a compliance chamber in the left pleural cavity, because the pump was a displacement pump and the air had to go somewhere. And it worked out quite fine. And to be honest, still, we don't have a system like this. Heartmate III, very sophisticated system, but still has a driveline. We are waiting for driveline-less systems. That's what I mentioned, you know, driveline infection is one of the major complications of LVAD therapy. For example, Heartmate III patients, in our experience, after 2 years, 80% of the patients had some kind of driveline infection, 20% were free of driveline infections. That's a very serious issue, which causes a lot of trouble for the patients at the end. Then in 2001, that was the start of the small pumps. So we started with the Heartmate II. It was a ball and cap bearing. So there were still bearings in the pump, axial flow. But to these times, when you compare it to the Novacor or whatever, you know, it was so small, and it was easy to implant, it was easy to transplant. So I think that was one of the biggest steps forward in the LVAD therapy. And now, you know, it is very simple because we only have one LVAD system available, and that's the Heartmate III. The good thing of that is, you know, that it's the best pump we had till now, because it's really sophisticated, because of the magnetically elevated impeller, the big gaps, you know, we don't see any pump thrombosis anymore. With the, you know, the washing out principle, that it's accelerating and decelerating 30 times a minute. So it's the only system we have at this moment as an LVAD, but it's by far the best we had.